Last guys and girls, yes ma'am. Right. So today we're going to discuss. So far we have been discussing about the fallopian tubes and the ovary. Is it not? Right. Okay. Today we'll deal with the uterus. Uterus is a. Hollow muscular structure of the female reproductive system. Is it not? All the pregnancy things and everything will happen over the uterus. You know that very well, right? The uterus is situated in pelvic cavity, is it or not? And lined on either sides and above and below by means of the peritoneum. Okay, we'll see that later. Okay, first of all, so the uterus have how many parts? Uterus have how many parts? Fundus, body and cervix. Okay, total 3 parts of uterus will be present. See everybody? So we are focusing on the sagittal section over here, and over here also. The sagittal section of the uterus and the vagina over here. And here we are focusing on anteroposterior view. Okay, anteroposterior view of the uterus over here. So if you see from the anteroposterior view of the uterus contains a part called the fundus, and then followed by the body and the cervix over here. Okay. So these two on either sides in between the fundus and body are nothing but the lateral angles of the uterus. Okay. So these lateral angles will be having the intramural openings of the uterine tubes over here. Okay. Above these openings is the fundus, and below these openings are nothing but the body over here. Okay. And then this body will become narrow and making the body of the uterus a pear-shaped appearance over here. Get it or not? Right. So this body will become narrow downwards and continues as cervix over here. Okay. So whenever this body is becoming narrowed over here, on the anterior aspect, this depression in between the body of the uterus and the cervix is termed as isthmus. Isthmus means junction or connection between the two things over here. Okay. So this depression is nothing but the isthmus. Okay. But on the posterior aspect, there is an elevated ridge over here towards the junction between the body of the uterus and the cervix. In front there is a depression. Behind there is an elevation or ridge, which is also termed as torus uterinus. You would have heard torus aorticus. It gets apart in the same manner. Torus uterus over here. Okay. So at this junction, whenever these two, one is depression, one is elevation present, that is the junction between the body of the uterus and the cervix of the uterus. Okay. Internally, these two are separated by means of an opening. That means the uterus connects to the cervix by means of an opening at the level of the isthmus is termed as internal os. Okay. And the cervix, whenever it is opening into the vagina over here, by means of an opening, once again opening is termed as the external os. Okay, getting it out? Isthmus, torus uterinus, internal os and external os over here. So this vertically arranged structure is nothing but the vagina over here. Okay, you can understand the cervix is passing through the anterior wall and reaching the posterior wall of the vagina over here. Okay, we'll be discussing that later. Okay, so the thing what you are supposed to understand is cervix is not separated from the vagina over here. it is within the vagina. The cervix is within the vagina. Okay. Based on this, we'll be discussing few clinical aspects. We'll discuss them later. So, this is the body and then cervix over here. This is the internal os and this is the external os over here. And one more thing, the fundus is a solid muscular part over here. Okay. While the body and cervix will be having the cavities inside over here. Get it out? Cervix and the body will be having the cavities, or within the lumen there will be a space over here. Within which structure? Within the body alone and within the cervix. Okay, with respect to the uterus over here. But fundus doesn't have any lumen over here or space inside the fundus over here. Got it over? This point is very much important. Okay. So what are the peritoneal coverings and pouches? You already know very well. So this is the peritoneum of the anterior abdominal wall over here, going over the superior surface of the urinary bladder over here, and then forms a pouch in between the isthmus and the superior surface of the bladder. By this you are supposed to understand this cervix on the anterior aspect is not covered by the peritoneum. This is very much important. So what are the coverings of the peritoneum over the uterus are very much important. Okay. So this peritoneum which is covering the uterus, the body and fundus of the uterus, will be reflecting at the level of the isthmus or internal os, you can say, on the internal aspect. From there towards the superior surface of the urinary bladder. By this you can understand the base of the bladder and the anterior surface of the cervix are not covered by the peritoneum. Get it over? And then it encloses on the anterior surface and of course the fundus and then the posterior surface of the uterus till the upper 1/4 of the vagina over here. For example, this part of the cervix is within the vagina over here. Okay, there are two parts of the cervix. One is the supravaginal part. This part is the supravaginal part. This part, and this small part is the supravaginal part above the vagina. Okay, and then the rest of the part is nothing but the intravaginal or vaginal part of the cervix. The cervix contains two parts. One is outside the vagina and one is inside the vagina. Outside it is termed as supravaginal part of the cervix, and the rest of the part is within the vagina over here. That is called the intravaginal part or vaginal part of the cervix over here. So obviously this is within the vagina. It can't able to get covered by means of the peritoneum, but this supravaginal part of the cervix over here towards the posterior aspect, along with the upper 1/4 of the vagina, are covered by the peritoneum over here. This you are supposed to understand. Okay, anterior surface is not at all covered by the peritoneum over here, but the posterior surface of the cervix of the supravaginal part is covered by the peritoneum over here, along with the vagina over here. Get it over? From there it will be reflecting over the anterior surface of the rectum over here. Get it over? So this pouch is termed as rectovesical pouch. Sorry. Utrovesical pouch, and then this pouch is in between rectum and uterus is rectovesical pouch of rectouterine pouch of okay. Utrovesical pouch and rectouterine pouch of Douglas over here. Okay. So this rectouterine pouch of Douglas will be connected to the perineal body by means of fascia called fascia of Denon-Villiers. Fascia of Denon-Villiers. Initially this peritoneum will be deeper over here, and later on it will be fused and will be forming a fascia over here. Okay. Actually the pouch of Douglas will be below till reaching the perineal body, but developmentally it will be fused later on and forms this fascia called the fascia of Denon-Villiers. Okay. So these are the parts of the uterus, and what are the relations now? So what are the relations over here with respect to the uterus and the cervix? You can easily say. So this anterior surface of the uterus, okay, body of the uterus, and of course the fundus also is related to the superior surface of the bladder. Isn't it or not? This body will be resting over the urinary bladder whenever the bladder is empty. When it is not empty, it will be pushed backwards. Get it? Okay. So this uterus is bending in this manner by means of two angles over here. What are those? supposed to know. One is the anti-version and one is anti-flexion. Whenever you are asked the uterus to show, these angles are the must. The first question will be from these things only. Okay. So anti-version and anti-flexion. Just remember, V for V means vagina. Version is with vagina. Flexion is with cervix. You will understand that. Okay. First of all, take the long axis of the vagina. This is the long axis of the vagina, which corresponds with the long axis of the pelvic outlet. Isn't it not? You know the pelvic outlet, how it is situated? This is the pelvic outlet over here. Is it not? Here is the pelvic inlet and this is the pelvic outlet. If you draw a line over here, passing through the axis of the pelvic outlet, that will be corresponding with the long axis of the vagina. Axis of the outlet corresponds with the long axis of the vagina over here. Okay. So, one more is the long axis of cervix over here. First of all. So this is the angle between the cervix of the uterus and the vagina, which is termed as anti-version over here. Cervix with vagina, cervix with uterus. Those are the two angles. So one is the cervix with the vagina, long axis of the cervix with the long axis of the vagina over here. Is termed as anti-version, which is about 90 degrees. Okay, which is about 90 degrees, almost 90 degrees. Okay. And anti-flexion means the axis, the angulation between long axis of the uterus and long axis of the cervix over here. Could you ever see that? This axis, again the same axis over here. Normally the anti-version is this angle. This angle is the anti-version between the long axis of the vagina and the long axis, the white lines over here of the cervix over here, which is about 90 degrees over here. And the long axis of the cervix with the long axis of the uterus, this is the angle over here, which is around 1.5 degrees, but few books says 170 degrees also. Okay, it seems to be not beyond 1.5 degrees, right? So, according to AKT, it is considered as 125, but other book says it is about 170 degrees over here. Okay, so this is like right angle, and this is like which angle? Right? Obtuse angle. Okay, 145 degrees or 170 degrees in between long axis of the uterus and long axis of the cervix. So anti-flexion means in between which and which? Anti-flexion means long axis of angle between the long axis of
uterus and cervix.
Long axis anti-flexion. Flexion, uterus, cervix. Long axis of uterus with the long axis of cervix is nothing but the anti-flexion. Anti-version means V for V. So cervix with vagina angulation and cervix with uterus angulation over here. Cervix with uterus is nothing but anti-flexion. Cervix with the vagina V is coming over here. Nothing but the anti-version, that is about 90 degrees over here. Okay. Anti-version is actually the relationship of the uterus with that of the vagina. Getting it or not? The anti-version means relationship of uterus with that of the vagina over here. Okay. So that's why V for V, nothing but the vagina over here. So easy to remember. V for V means anti-version means in between vagina and cervix. Okay. So with this angulation, the uterus will be lying over the superior surface of the urinary bladder. Could you understand? So that in case of empty bladder, the uterus will be coming over here and resting over the superior surface of the urinary bladder over here. Get it up? So then what are the relations over here? First of all, anterior surface is related to the superior surface of the urinary bladder. Okay. And towards the posterior surface, what structures might be present over here with respect to the body of the uterus? Easy to imagine? Coils of small intestine and of course sigmoid colon also. Isn't it not? So this is the rectum over here. There must be sigmoid colon above, and other areas will be occupied by the small intestines. Is it not? Nothing but the ileum. Is it not? Have you seen not ileum? Right? So coils of the intestine, nothing but the small intestine, nothing but the ileum. Along with the sigmoid colon are the relations of the posterior surface of the body of the uterus over here. Getting it out? Right? So not only the posterior surface of the body, but the supravaginal part of the posterior surface of the cervix also relates to the same small intestines and sigmoid colon over here, because it is very much close to the recto-uterine pouch of Douglas. The content of the recto-uterine pouch of Douglas is nothing but also small intestine and sigmoid colon. So obviously whatever are very much close to these structures, nothing but the pouch of Douglas, are the relations of the posterior surface of the body and supravaginal part of the posterior surface of the cervix of the uterus over here. Got it? In the same manner, the anterior surface of the cervix over here, even though it is not peritoneal covered, but it is related to which structure over here? Urinary bladder, but which aspect? Base of the bladder. This base is related to the supravaginal part of the anterior surface of the cervix over here. Is it not? The base of the bladder, of course, vagina is also related, but only with respect to the cervix, this is the relation over here. Getting it? So, uterus body, urinary bladder in front, and on back side will be the also small intestine and sigmoid colon over here. Is it not? Right? So, with respect to the cervix, this supravaginal part on the posterior aspect is related to again the contents of the pouch of Douglas over here, but in front it is related to the base of the urinary bladder over here. Okay, and this is the intravaginal part of the cervix over here, is within the cavity of the vagina over here. Getting it on? Is within the cavity of the vagina. This is very much important. Okay, and see properly, this part is termed as the internal os in between the body and cervix over here. And in between the cervix and the vaginal wall, this opening is termed as external os. External os. Okay, then it's an opening over here. If you see properly, this external os will be reaching the posterior abdominal wall over here. Getting it? So the external os will be reaching the posterior abdominal wall. It will not be restricted only to the anterior vaginal wall. It will be reaching till the posterior abdominal wall over here. Sorry, posterior vaginal wall over here. Getting it? This relation is very much important over here. Okay. So, coming to the vagina, what are the relations? You can easily say. What are the relations? Now, anterior aspect it will be related to the base of the bladder and of course the urethra. Further downwards into the urethra. Okay. And this urethra, female urethra, will be passing towards the lower one-third of the vagina on the anterior wall. This urethra will be passing through the anterior wall of the vagina. Get it or not? So this is a vaginal wall over here in this manner. The urethra will be passing through the anterior vaginal wall in the lower one-third of the vagina over here. So it will be going through the anterior vaginal wall over here and opens into the vestibule. We will be discussing that later. Okay. So ureter, the lower one-third will be within the wall of the anterior wall of the vagina. This you are supposed to remember. But rest of the part will be outside the vaginal wall. Okay. So behind, with which it will be related, the vagina will be related to the ample of the rectum and further downwards by means of anal canal. Is it not? Ample of the rectum and further downwards by means of anal canal. Anal canal will be just below the tip of the, what is it, coccyx over here. Is it not? About 2.5 centimeters below the tip of the coccyx will be the anorectal junction over here. So, the lower part will be related to the anal canal and the upper part is related to the ample of the rectum over here. Got it already? Right? So, these are the relations and peritoneal coverings of the uterus over here. These peritoneal relations or peritoneal coverings are very much important, either theoretical or practical. Okay, you are supposed to know these things. Okay. Okay, let us see few critical things over here. Let us see few critical things. First of all, there are two fallopian tubes over here to prevent the pregnancy after completion of the family, after having 2 or 3 children. The female wants to prevent the pregnancy from occurrence. What the doctor will be doing to the patient? There will be ligation of the tube of the fallopian tube at 2 parts over here. Okay, the ligation will be done in 2 parts and this segment will be separated. Get it or not? So this segment of the fallopian tube will be separated over here. So there is no contact between this part of the uterine tube with this part of the uterine tube. So sperm can't reach the ovum over here or ovum can't pass beyond this lacuna over here. then what happens to the oocytes over here? The male patients undergo vasectomy. What is vasectomy? Vasectomy is cut at 2 points and that segment will be separated over here. So what will happen to the spermatozoa which will be produced by the male? Degenerate. So within this part of the fallopian tube, close to the infundiculum and everything, the oocytes later on will get degenerated. In the same manner, spermatozoa also proximal to the, the lacuna, the spermatozoa will be degenerated over here. Okay. No functional alteration will be there, but degeneration will be happening over here. Okay. So then followed by, so if there is a pus, we have already discussed in the last class, if there is a pus in the fallopian tube, which is termed as, pus in the fallopian tube is termed as, what is it? Pyosalpinx. Pyosalpinx means tube. So pus in the fallopian tube is termed as pyosalpinx. So if there is a pus over here, if it gets leaked through this pelvic ostium of the fallopian tube, it will be either trickled into the pouch of Douglas or into rectovesical pouch over here. Sorry, utrovesical pouch over here. Do you understand? If there is a pus within the fallopian tube, nothing but the pyosalpinx, that may be trickled downwards into the pouch of Douglas over here or into the, what is it? Utrovesical pouch over here. Okay. So if it is in the rectouterine pouch of Douglas, how it will be evacuated? That means how the pus will be removed over here. There are two terms which you are supposed to know. One is synthesis, and then one is these two terminologies you are supposed to know. One is synthesis. Synthesis means aspiration. That means you are removing a fluid, either pus or blood or bone marrow, whatever it might be. Whenever you are removing from certain area, that is called synthesis. Synthesis over here. Okay. Synthesis means actually this colpo or caldo will be used for vagina and cervix, of course. Vagina mainly. Okay. So what you are supposed to do is you will be putting the needle through this vagina and will be piercing the posterior vaginal wall over here and will be reaching the pouch of Douglas and you will be aspirating the pus from the pouch of Douglas over here. Get it over? This aspiration is termed as the synthesis over here, and whatever the opening you are creating in the posterior vaginal wall, the procedure is termed as posterior colpotomy. Tomy means opening, cutting and opening. Okay, so you are opening the posterior vaginal wall over here. Okay, posterior colpotomy. Okay, this procedure is very much important. You will be passing the needle through this vagina and piercing the posterior vaginal wall and reaching the, what is this? Pouch of Douglas, and you will be aspirating the pus. What might be the complication if you insert the needle a bit further forward? Above. Intestinal perforation will occur. Then how to do this procedure? So automatically, whenever you insert a needle, the pus will be easily automatically aspirated. Okay. And one more thing, because of the presence of the pus, the intestines will be pushed upwards or floating. The intestines will be floating over the either blood or the pus over here. So you can easily separate the pus all the way from the intestines very easily. Getting it on? Because the intestines are floating over the pus over here, you will not be injuring the intestine. As soon as you insert the needle, the pus will be drawn back automatically. Getting it on? Because of the pressure, because of the abdominal pressure, the pus will be automatically drains into the needle over here. Getting it on? So that most probably you will not be injuring the intestines over here. This is termed as posterior colpotomy, and aspiration is nothing but synthesis. Got it? So there is a term called levo rotation of the uterus or Dextro-rotation of the uterus. What is the evo-rotation and dextro-rotation of the uterus means? What? Left side rotation is termed as levo-rotation and right side rotation is termed as dextro-rotation of the uterus. How these rotations occurs? Because of this anteversion and anteflexion, the levo-rotation and dextro-rotation of the uterus occurs, not the cervix. Try to understand this. What is it? Levo-rotation of only uterus. Any doubt? Levo-rotation of only uterus, not the cervix or the vagina. Try to remember this. Levo-rotation of the uterus or dextro-rotation of the uterus. If these rotations occurs because of the anteversion and anteflexion, what will happen? What will happen? What will happen?
Intestinal obstruction.
Not intestinal obstruction. The cells are situated below. If it might be rotated in this side, it might be rotated on that side. What will happen? For example, if there is a malignancy within the uterus over here, the uterus bulk will be increased. Okay. So if it is levo-rotated or if it is dextro-rotated, it will be compressing on a structure. What is the structure? Obturator nerve. Okay, it is a bit fast. What is it? Cervix will not move. Only the uterus will move. What will happen? Ureter, exactly. Because ureter will be on the way passing over here and goes towards the urinary bladder over here. The urinary bladder, the ureter will be coming very much close to this part of the uterus based on the levo-rotated left ureter, based on the dextro-rotated right ureter. If it is more mass, the mass is more enlarged over here, that may compress the ureter. That leads to again hydronephrosis over here. Got it down, everybody? Okay. So, which factors are keeping the uterus and vagina in position? This is very much important theoretical question and of course practical also. What are the structures which are keeping the uterus in this position? So it is antecoagulated and anteflexed, it's okay. But which structures are causing this angulation we are supposed to know? You already know few structures which are keeping this anteflexed position. What are the things? Suspensor ligament of, those are related to the fallopian tubes, right? Round ligament. There are two sorts of ligaments. One are true ligaments and one is false ligaments. What the true ligaments means? It must be derived from endopelvic fascia. What is endopelvic fascia? Very easy. We have already seen, I have already described you how the pelvic fascia is covering the structures on lateral pelvic wall and the viscera. Isn't it or not? So this will be which muscle? Obturator internus. Imagine the lateral pelvic wall. Lateral pelvic wall will be having obturator foramen. Around it will be the obturator internus muscle. Okay. And the obturator internus muscle will be covered on either sides by means of fascia called pelvic fascia. It's okay. Obturator fascia is actually it is the pelvic fascia. The names might be varying based on the location. It's okay. So the pelvic fascia covering the obturator internus, and further downwards it will be covering the pelvic floor muscle. What is it? What is it? Pelvic floor muscle. Pelvic floor is not open in the lecture class or not? Open no? Levator ani. The levator ani. Further downwards, the pelvic floor will be covered by the levator ani. Above the levator ani will be again the pelvic fascia. And then onwards, because the levator ani will be hanging all the pelvic viscera over here. Further, medial it will be covering the pelvic organs. Nothing but the urinary bladder, prostate, uterus, and further behind will be rectum. Leave out the rectum and everything. We are concerned only with the uterus over here. Whatever the fascia which is covering the uterus, and of course in case of males, prostate and urinary bladder is termed as the endopelvic fascia. So the fascia which is covering the lateral wall of the pelvis, and floor of the pelvis is nothing but the pelvic fascia. But the same fascia which is covering the organs over here is termed as the endopelvic fascia. That is the only difference. Okay? Organs, endopelvic fascia, pelvic floor, and obturator internus, pelvic fascia over here. That is the only difference. Okay? So the ligaments are derived from the true ligaments are derived from the endopelvic fascia, which is made up of fibromuscular elements. Fibromuscular. Okay. Smooth muscles will be present here and there, along with the collagen fibers over here. Okay. So, and coming to the false ligaments are nothing but the peritoneal folds. So, these structures are very much important. What are those? True ligaments of the uterus, which keeps the uterus in this anatomical position, and also false ligaments. To some extent, they will support the uterus over here. Getting it on? So, apart from these ligaments, what other structures will support the uterus over here? Apart from the ligaments, we will discuss the ligaments a bit later. So, these are the ligaments which are the fibrous elements, and this is the mesothelium over here. What are the other structures? Muscles. What are the muscles? Levator ani. What muscles might be supporting over here? Okay. The levator ani contains pubococcygeus. Is it or not? The pubococcygeus is again divided into pubovaginalis and puborectalis. So far we have been concerned over here is nothing but the pubovaginalis and puborectalis. From where it is arising? Pubis. No? So from the pubis, a muscle will arise over here around the vagina, that is termed as pubovaginalis. Pubovaginalis. It will be arising on either sides, enveloping the vagina over here in this manner. That is nothing but the pubovaginalis over here. Okay, that will be supporting the posterior wall of the vagina over here. Getting it on? Why this posterior wall of the vagina is supported over here? Why the posterior wall of the vagina is supported over here? Why? Childbirth. Okay, but basically normal anatomy. Childbirth is okay, and then normal anatomically. So if the vagina is supported over here, then only it can support the uterus over here. Getting it on? The anteverted and anteflexed part of the uterus is supported by the vagina. For example, if it is not supported, if it is absolutely, if it is sagging downward, so easily the uterus can prolapse over here. What is prolapse means?
Deviation from anatomical position.
What?
Deviation from anatomical position.
Absolutely, deviation from anatomical position, or the slippage or dislocation of the uterus from its normal anatomical position to any other exterior area. Whatever it means. That is called the prolapse of the uterus. So if the vagina is not supported in front by means of urinary, behind by means of this, what is it? Ample of the rectum and this pubovaginalis over here. So easily the vagina will become lax over here, and that leads to uterine prolapse over here. So the posterior wall of the vagina must be supported by means of a muscle called the pubovaginalis. And one more, puborectalis. Again the same thing, puborectalis over here. See here, this puborectalis and pubovaginalis are parts of levator ani muscle. So this is a rectalis over here. That will be encircling the anorectal junction. Try to understand this. Anorectal junction is encircled by means of a muscle called puborectalis over here. Okay, puborectalis over here. So why this puborectalis is needed? For the support of the uterus. So you can see a curvature. This is a sacral curvature and this is the anal over here. Anal inclination over here. This is not the sacral curvature, because this will be curving along with the curvature of the sacrum over here. And this curvature will be forming this protrusion over here. Could you understand? The ample. Okay. And then further below, the anal canal will go over here. So this curvature is needed to support the vagina over here. Get it out? So this curvature, nothing but the rectal ampulla, will be supporting the posterior wall of the vagina above. So to produce this curvature, this must be going around the rectum, anorectal junction over here, pulling the anorectal junction forward. So that this curvature will be maintained and this will be supporting the posterior wall of the vagina that indirectly supports the uterus over here. Getting it out? So what are the muscles which are needed over here? One is pubo-vaginalis, directly supports the vagina, and one is pubo-rectalis, indirectly supports the uterus over here. Got it out? These are the muscles which supports the uterus and preventing it from getting into prolapse over here. Get it out? Right. So these are the muscles, and what are the other structures? What are the other structures here? Ligaments over, muscles over, and the viscera. What are the viscera which are supporting it over here? Behind nothing but the ampulla of the rectum, and in front by means of base of the urinary bladder. Okay, the base of the urinary bladder, of course, the superior surface, it will be overlapping over. It is not a support, it is just overlying it. But the base of the urinary bladder is supporting the vagina over here, and the rectal ampulla is supporting the vagina on the posterior aspect. So in front and behind, the vagina will be supported over here by means of these two viscera. Okay, right. And if the pelvic fascia and endopelvic fascia is going over here, in between these two there is a loose areolar tissue over here. That also supports the uterus over here. Loose areolar tissue in between the pelvic fascia and endopelvic fascia over here. That will support the uterus. Could you ever imagine? In between the pelvic fascia and the endopelvic fascia, this is filled with the loose areolar tissue. That means along with the fat, fibrous tissue and everything, it will be filled over here. That will be supporting the uterus which is staying over here. Getting it on? So in front, base of the bladder, behind rectal ampulla, and on either sides by means of this loose areolar tissue which is in the pouch which is formed by the pelvic fascia and endopelvic fascia over here. Okay. This is also termed as exactly parametrium. Metrium means belongs to uterus. Parallel to uterus is nothing but the parametrium. That is nothing but the loose areolar connective tissue which is containing all the adipose tissue and everything. It is packed in between the pelvic fascia and endopelvic fascia, supporting the uterus on either sides. So in front, behind, on either sides are supported by means of all these factors over here. Getting it out? So let us see the ligaments. First of all, the true ligaments. What are the true ligaments we have? True ligaments, you already know. What are those? Exactly. Round ligament, and then Beckenbroad's ligament, and then followed by. So here, remember, there are folds which are connecting the cervix with the pubis on the anterior aspect, and there are ligaments which are connecting the cervix with the sacrum. So on the anterior aspect, pubis is connected to the cervix by means of a ligament, and then from the sacrum, or third part of the third sacral vertebra over here, till the cervix, there will be two more ligaments over here. So what might be the names of these ligaments? Pubocervical ligament. One is the pubocervical ligament over here. Pubocervical ligament, one on this side and one on that side. A pair of pubocervical ligaments. So a pair of round ligaments, a pair of Beckenbroad's ligaments, a pair of pubocervical ligaments, and one more pair in between cervix and the sacrum might be uterosacral or sacrocervical. Okay, uterosacral or cervicosacral. Always remember, the true ligaments will be in between the bone and the viscera over here, but the false ligaments will be in between viscera and viscera. Okay, easy to remember. Okay, true ligaments will be in between of course, the round ligament is, of course, it is going towards the skin over here, leave about that. But the Beckenbroad's ligament and the pubocervical and uterosacral ligaments, all these will be going towards the fascia and the bones over here. Try to remember this problem. In between the viscera will be the false ligaments, which are nothing but the peritoneal ligaments, peritoneal folds over here. Okay, try to understand. Okay. So how many? Okay. So to the 8 true ligaments you are supposed to remember. What are the ligaments? First of all, there are round ligaments. What are where the round ligaments are situated? I have already told you the relation. Round ligaments. Lateral angle, very good. Inferior, posterior inferior or anterior inferior? Anterior inferior. Because round ligaments will be connecting nothing but the lateral angle of the uterus with that of the labia majora over here. After passing through, first of all the deep ring and then followed by the superficial ring and eventually reaches the labia majora over here. Get it out? Right? So it will be crossing an artery over here just like this spermatogenesis, just like the vas deferens. What is that artery? What is it? No. Uterine artery is absolutely not related over here. Inferior epigastric artery, just like the vas deferens, which to the vas deferens, the inferior epigastric artery will be on the medial aspect. Is it not? Is it not right? Yes. Because the deep ring is situated lateral to the inferior epigastric artery, so obviously the vas deferens will be lying lateral to the inferior epigastric artery. In the same manner, the round ligament of the uterus also passes exactly just like the vas deferens, so obviously it will be lying lateral to inferior epigastric artery. Is it not right? So here will be the deep ring over here, here will be the superficial inguinal ring over here, and eventually reaches the labia majus, nothing but the skin part. So it will be dividing into multiple small fibers and will be attached to the labium major. Get it out? Labium major. So labium major is derived from, labium majora is derived from, I have already told you, everyone knows that term. The term is very much important. What is this term? Genital swelling. Either the scrotum on either sides or the two labia majora on either sides will be arising from genital swelling. This genital swelling term will be asked in the examination. Okay, always remember. So the genital swelling will not fuse in case of females, but will be fused in case of males, forming the entire scrotum, leaving a median raphe over here. Okay. So first of all, we have seen the round ligaments, then followed by McEnroe's ligament. This McEnroe's ligament you are supposed to understand.
পড়াশোনা হয়ে শত নাম্বারের অধিকারী হব সদা সুহাগন রহ শত জন্ম বুঝতে পারলাম এটা শিখে যাবে না
try to understand. This is the broad ligament of the uterus. Okay. What's the broad ligament? I have already told you. As if, for example, think that these are my hands over here, over which the bed sheets are hanging downwards over here. Okay. Right. So this is the anterior layer of the bed sheet over here, or nothing but the broad ligament over here. And this is the posterior layer of the broad ligament over here. Could you able to understand the diagram over here? Could you able to understand? So by this you can understand it is hanging over the fallopian tube, but 2/3 part of the fallopian tube will be covered by this broad ligament. But from then onwards, it will become suspensory ligament of the, what is that? Ovary. Exactly. Okay. So what is that? The broad ligament is over here, lying on either sides of the uterus on the lateral aspect. That means the lateral borders of the uterus is related to the broad ligaments on either sides. Getting it or not? Right? So this broad ligament is having an anterior layer and going above the fallopian tube and becomes the posterior layer over here. Okay. Now see that this is the pelvic floor muscle, that is nothing but the levator ani over here. Okay. So whenever it is reaching the pelvic floor over here, the anterior layer will be reflecting upwards in this manner. Getting it or not? And the posterior layer will be reflecting backwards over here. Okay. And this anterior layer will be reflecting over here and joins with the peritoneum of the anterior abdominal wall over here. It will be coming all the way from here and goes over here and joins with the anterior abdominal peritoneum. The same manner it will be going over here and joins with the posterior abdominal peritoneum over here. Okay. So this is termed as the antero-inferior surface of the broad ligament over here. Why it is antero-inferior? See here, if the fallopian tubes are situated in this manner, the broad ligament is covering it in this manner. Getting it or not? The broad ligament is covering and going obliquely in this manner. So this automatically will become antero-inferior surface, and the other layer on the posterior aspect, the layer will be facing upwards, that is termed as posterior-superior layer, exactly opposite to the stomach surfaces over here. Getting it or not? So this is termed as the antero-inferior surface because uterus is anti-flexed over here. So the broad ligaments will be in this manner and is attached to the lateral border of the uterus. So obviously the layer will be facing, the surface will be facing downwards and front. So antero-inferior surface over here, and this surface is nothing but the posterior-superior surface of the posterior layer of the broad ligament over here. So the posterior layer will be giving rise to a fold which attaches to the ovary that acts as the hilum, that is termed as meso-ovarium, carrying the ovarian vessels over here. Okay. Okay. So what is mesosalpinx? What is mesosalpinx over here? Okay. What is mesosalpinx? We see. So for example, ovaries must be on the posterior aspect, is it not? Connecting the lower end of the ovary with that of the lateral angle of the uterus, there will be a ligament that is nothing but ligament of ovary. Okay. This ligament of ovary is also a part of broad ligament over here. The ligament of ovary is also part of broad ligament. That means the ovary is hanged by means of the suspensory ligament of ovary, and the ligament of ovary connects the lateral angle of the uterus with that of the ovary. Both are derived from the broad ligament over here. Getting it or not? So the ovary is hanged by means of broad ligament, whatever the names might be, in the manner of suspensory ligament or ligament of ovary. So what is mesosalpinx? These things you are supposed to understand. Mesosalpinx. What is mesosalpinx? Mesosalpinx means in between the ligament of ovary and the uterine tube covered by the broad ligament. This area is termed as mesosalpinx. Getting it or not? Mesosalpinx, just like the transverse mesocolon. Mesosalpinx means in between the ligament of ovary and the ovary on the posterior aspect. The ovaries are situated over here, for example. Okay, the broad ligament in between the ligament of ovary, for example. This is the ligament of ovary, and this is the upper part of the broad ligament over here. In between the ovary and the ligament of ovary and this fallopian tube, this area of broad ligament is termed as mesosalpinx over here. And below this ovary and ligament of ovary, this area of broad ligament is termed as mesometrium. Metrium means uterus. Okay. Parametrium or mesometrium. Okay, mesometrium over here. So this part in between the fallopian tube and the ligament of ovary and ovary. So this, if you take it as a boundary over here, this is the lower boundary of the mesosalpinx over here. and from this downwards, this entirely is termed as the mesometrium. So the broad ligament is divided into different terminologies over here. One is the suspensory ligament, one is the ligament of ovary, one is the mesosalpinx. Mesosalpinx also covers the or encloses the fallopian tube over here. So the content of the mesosalpinx is fallopian tube, and also the vessels which are going over here. What are those? Uterine artery and ovarian artery also are the contents of the mesosalpinx over here. The vessels are lying close to the uterine tube are uterine artery and ovarian artery. Both are the contents of the mesosalpinx over here. Getting it on? So now, whenever the mesometrium goes downwards, it will be reflected in front and reflected behind over here. So this border which is attached to the pelvic floor muscles is termed as the attached border of the broad ligament. So what are the borders of the broad ligament? This is the upper border over here, this is the lateral border, this is the medial border, and this is the lower border or attached border over here. This lower border will be attached to the levator ani and then reflects forward and reflects backwards. Getting it or not? Getting it or not, right? So for example, if you pour some sand on the floor, initially it will hit the floor and then it will be reflected here and there. In the same manner, the broad ligament will be hitting the pelvic floor muscle and then reflects anteriorly and reflects posteriorly. Getting it or not? So whenever it is reflecting over here, there will be a ligament which is formed over here, connecting the cervix with that of the fascia covering the lateral pelvic wall, nothing but the pelvic fascia. What might be that ligament? What is it, right? Yeah, transverse ligament is also termed as McEnroe's ligament. Okay, this is connecting the. So remember properly. Below this broad ligament is the McEnroe's ligament over here. What is that? McEnroe's ligament. McEnroe's ligament is a true ligament, but broad ligament is a false ligament. Broad ligament is nothing but the peritoneal. Peritoneal folds are nothing but false ligaments over here. This is the McEnroe's ligament or transverse cervical ligaments over here, which is also termed as the cardinal ligament. Why cardinal ligament it is termed as? Absolutely, it is the main ligament which supports the uterus over here. Getting it or not? So the McEnroe's ligament is the transversely arranged ligament connecting the cervix, not only the cervix, the supravaginal part of the cervix also. The supravaginal part of the cervix and the vagina. The upper part of the vagina along with the supravaginal part of the cervix will be connected to the pelvic fascia over the lateral pelvic wall by means of a ligament, true ligament. So it is derived from the endopelvic fascia, which contains the fibromuscular structure that is nothing but the McEnroe's ligament. Okay, here you are supposed to understand as an important relation the ureter. The ureter will be passing in between the lower attached border of the broad ligament and this McEnroe's ligament. This relation is very much important. Try to remember properly. Okay. Above is the broad ligament, below is the McEnroe's ligament. In between those two passes the ureter in this manner. If you imagine the urinary bladder over here, the ureter passes in between these two layers and joins with the urinary bladder over here. Getting it over? So this is the ureter over here. For example, left ureter. The relation of this left ureter with that of the uterine artery is, I have already told you in the last class, how the uterine artery is related with that of the ureter. For example, there is an, yeah, exactly. For example, this is which artery, from which uterine artery we are raising? Uterine arteries are raising from? Anterior division of uterine iliac artery. So this is the anterior division of the uterine iliac artery, for example, lying over the lateral pelvic wall. That is giving rise to an uterine artery that will go all the way from lateral to medial aspect and goes above the ureter and enters into the two layers of the broad ligament just lateral to the lateral border of the uterus over here. Try to understand this properly. Okay. I have separated these layers over here, but these layers are attached to the uterus over here. Try to understand this. Okay, just to make you understand, I have separated these layers. But basically, the broad ligament will be clearly attached to the lateral border of the uterus over here. Getting it or not? These two layers over here are attached to the broad ligament of the uterus. Okay. Do you think that this lateral border is covered by the peritoneum or not? For example, this is a uterus over here. So the broad ligament is attached in this manner. In this manner. On, you're looking from above downwards over here. This is the anterior aspect of the uterus. This is the posterior aspect of the uterus over here. These are the two lateral borders of the uterus. This is the posterior layer of the broad ligament. This is the anterior layer of the broad ligament over here. Both are attached to the lateral border. But you can see a small gap which is left over here. So the lateral border is not covered by the peritoneum, nothing but the broad ligament over here. So what is happening with this gap? The uterine artery will be going upwards through this gap over here. Getting it or not? So the uterine artery will be going through the gap in between the broad ligament and the lateral border of the uterus over here. Getting it or not? Right? So the uterine artery will be arising from the anterior division of the uterine artery that goes medially and goes above the ureter and reaches the lateral border of the uterus and goes upwards in between the two layers of the broad ligament and the lateral border of the uterus upwards and anastomoses with the ovarian artery at the lateral angle of the uterus over here. Got it or not? Right? This relation is very much important. And one more thing, there are presence of lymphatic nodes over here which are called the paracervical nodes over here. Okay. So at this junction, whenever there is a crossing of or overlapping of this uterine artery with respect to the ureter, at this junction there are few lymphatic nodules over here. Those are nothing but the parallel to the paracervical nodes over here, lymph nodes over here. So for example, there is an infection of the cervix over here that will be spreading to this lymph node over here. So what complication the patient will be getting? The lymph nodes are enlarged over here. At this junction, what will happen? Exactly, the ureter will be compressed over here. Again, there will be an obstruction to the ureter that leads to hydronephrosis again over here. Getting it on? Okay. For example, during hysterectomy, what is it? Hysterectomy. Hysterectomy means removal of the uterus. Okay. For example, in case of bleeding uterus, for example, in case of postmenopausal females, for example, there is a small malignancy, it has not reached into the metastasis level, so the hysterectomy must be done. So during the hysterectomy, the uterus must be removed after clamping the uterine arteries over here. If you don't clamp means just holding the artery in this manner, closing the artery in this manner. Okay. So if you don't clamp the artery, there will be continuous hemorrhage over here. So for that sake, you are supposed to clamp this artery and then you have to remove the uterus over here. So the blood supply to the uterus will be stopped. Okay, there is no uterus, no need of blood supply also. During this time, the doctor may clamp the ureter also, or during removal of this uterus, he may cut the ureter also. Getting it or not? So the ureter, whenever it is passing over here towards the urinary bladder, whenever he is removing the uterus along with the ligaments over here, he may cut the ureter also. That leads to extravasation of the urine into what is it? Above the pelvis will be the pelvic fascia. Is it not? Into the pelvic cavity. Pelvic cavity will be the extravasation of the urine will occur. Or if the doctor clamps the ureter along with the uterine artery by mistake, so what will happen? It will land up in hydronephrosis. Got it or not? Hydronephrosis also. Okay. Okay. So far we have seen how many true ligaments? One is the round ligament of the uterus and then followed by McEnroth's ligament, and the other ligaments are in between the pubis and the cervical region over here. That is nothing but the pubo-cervical ligaments, two pubo-cervical ligaments, and the other ligaments are pubo-sacral, which will be reached. Pubo-sacral, which will be reached. Pubo-sacral or utero. Yeah, cervicosacral or uterosacral. Whatever sacral. Sacral is okay. Sometimes my brain will get off, right? Just try to we are off. Already off. Okay, fine. But still you are supposed to know, obviously. So in between the cervix and the pubis, there are two ligaments, one on right side and one on left side. That is called the pubo-cervical ligaments. And then in between the cervix and the third sacral vertebra, there will be another ligaments which are termed as cervicosacral ligaments. ligaments are uterosacral ligaments. There are two pairs. So two round ligaments and two Mechand-Rod's ligaments and two pubocervical and two cervicosacral ligaments. How many totally? 8 true ligaments. Okay. So these are the 8 true ligaments you are supposed to know. And then false ligaments are, one is the broad ligament, a pair of broad ligaments on either sides, and then followed by, so I have told you already, in between the viscera there will be false ligaments. Okay. There are a pair of false ligaments in between the, cervix and the ampulla of the rectum over here, or middle 1/3 of the rectum over here. So that fold are paired folds on either sides. Those are termed as rectum, cervix, rectouterine or rectocervical folds of peritoneum over here. These are called the false ligaments. Okay, a pair of false ligaments, rectouterine folds or rectocervical folds over here, and a single false ligament in front, that is nothing but connecting the superior surface of the urinary bladder and the uterus, that is nothing but the uterovesical fold of the peritoneum over here. So these are 2 and this is 1, how many? 3 and 4, 5 and any other? Yeah, one more thing. One more thing is the cervicovaginal over here. Okay, or vaginocervical. Try to understand this. In between the two viscera, nothing but the cervix and the rectum, and in between the cervix and the vagina. What? Yes. What I was saying, the cervix and the vagina. Okay. Okay. In between the cervix and the rectum over here, and in between the cervix and the vagina over here. Sorry, sir. Try to understand this. Okay. Try to adjust. Okay. Right, you are understanding the diagram, right? Yes. Okay. So cervico rectal fold, 2 folds will be cervicorectal and 1 fold will be cervico anal. Okay, anal. Okay. Sorry. This is not thing. Sorry. Rectovaginal. Sorry, absolutely sorry. My brain is off. Try to understand from the rectum, from the middle 1/3 of the rectum till the cervix, and from the middle of the rectum till the vagina over here. Okay. So these are 2 folds and this is 1 fold. These are the peritoneal folds on either sides. Try to understand. So between the cervix and the rectum, middle 1/3 of the rectum, these are the cervico-rectal folds over here, and below that there will be rectovaginal fold over here. If you see properly, over here is the recto-uterine pouch of Douglas over here. Is it not? Recto-uterine pouch of Douglas, this part. Okay. This part on either side, the recto-uterine pouch of Douglas, the boundaries are on either side by means of this recto-cervical folds, and the floor is formed by this rectovaginal fold. Could you able to understand? So it will be in this manner. Try to understand this. Okay. So in between the uterus and the rectum over here, there are 3 folds in this manner. Okay. On either sides connecting the cervix and the middle 1/3 of the rectum are these recto-cervical folds over here, or recto-uterine folds over here. You can see that. Okay. And the below fold is nothing but the rectovaginal fold over here. So these 3 folds will be forming a pouch over here. Could you able to see that? This pouch over here. So this pouch, the floor is formed by the rectovaginal fold over here, and on either side is forming the recto-uterine folds over here. So as a whole it will be forming the recto-uterine pouch of Douglas over here. So these are the 2 lateral boundaries, and this is the floor of the recto-uterine pouch of Douglas over here. Could you able to understand? So whenever these are running over here, the sacro, you can see that the sacro-cervical ligaments are running just beneath these folds over here. Getting it or not? For example, the peritoneal folds are going in this manner. That means the recto-uterine folds over here. Beneath the recto-uterine folds is the cervico. So what is that? Uterosacral ligament over here. Could you understand or not? No? For example, towards the sacrum, third sacral vertebra over here. Okay? This is nothing but the sacrocervical ligament over here, which is a true ligament over here. So overlapping with a fold of peritoneum covering this ligament over here, extending between the cervix and the middle 1/3 of the rectum is a fold of peritoneum, that is nothing but the recto-uterine folds of peritoneum over here, which are nothing but the false ligaments over here. So this is the false ligament extending between the cervix and the rectum over here, and this is the beneath that lies the true ligament extending between the cervix and the sacrum over here. Get it or not? So the true fold, true ligament is lying beneath the, what is it? False ligament over here. Get it or not? So the false ligaments are in between the uterus and the urinary bladder, and the uterus and the rectum over here. Getting it or not, everybody? False ligaments are in between the viscera. True ligaments are in between the bone and the uterus. Bone and the uterus are on either sides with that of the pelvic fascia over here. Getting it or not? And one more true ligament is a round ligament that will be attached to the labia majora over here. Okay, getting it or not? False ligaments in between the viscera. True ligaments in between the bones and the viscera over here. Try to remember this problem. Okay. So these are the true ligaments and the muscles and the fascia, nothing but the loose areolar fascia between the pelvic and endopelvic fascia, will be supporting the uterus as a whole. Get it on? Along with the levator and muscles, nothing but the vaginalis and puborectalis will be supported. Puborectalis will be indirectly supporting the vagina, so that indirectly supports the uterus, and pubovaginalis will be supporting the posterior wall of the vagina, that directly supports the uterus of the Getting it on, everybody? Getting it on, right? Clear or not, everybody? Right? These things are very much important. That's why I'm stressing again and again. Okay. So true ligaments and false ligaments of the uterus. Okay. So about the lumen of the uterus, not sachet, but it will take some more time. Not sachet. So the uterus, the lumen will be in the form of T shape. Okay. Okay, it will be in the form of T shape, lumen. But in case of cervix and vagina, there will be two longitudinal folds on the anterior wall and posterior wall. Okay, that will be giving rise to multiple branches over here. Getting it over? So these elevations will be fit in the depressions on the opposite wall. Getting it over? Try to understand this properly. The cervical and vaginal walls on the anterior wall and posterior wall. Anterior wall and posterior wall of the cervix and vagina will be having longitudinal mucosal fold which will be branching over here, which is termed as arbor vitae. Have you ever heard? What? So, arbor vitae means what? It's like a branching tree, Christmas tree appearance over here, right? So, arbor vitae form of mucosal folds over here. Yeah, you know, these mucosal folds on one side if it is elevated, on the other side it is depressed. Okay, these will be fixed with each other, and the entire cervix and vagina will be closed. Okay, getting it out right? We'll finish it off. Right? Don't frustrate. Okay, we'll finish it off because this is important. So come on everybody, let us focus. The last final things over here. Okay, we'll see the viscera when we leave. Okay. So let us focus. Doderlings bacillus is the bacteria which is a normal inhabitant of the female's vagina. In case of female vagina, there is a normal healthy bacteria called the Doderlings bacillus which is present over the female vagina alone. Okay. So what is happening in the female vagina? Female vagina will be acidic or basic or neutral. Why it is acidic? What right?
Because of the acidic secretion
What
of
right?
Secretions of the
Secretions of
bacteria. And
So what might be the epithelium of the vagina? What might be the epithelium of vagina? What is the epithelium of the vagina? Stratified squamous, non-keratinized epithelium. It is not a skin. It is not a skin. Okay. It is a non-keratinized, stratified squamous epithelium, not the columnar epithelium. Okay. Okay. Perfect. So the epithelium will be having abundant glycogen over the upper layer of the cells over here. Try to understand this. The vagina is being lined by squamous epithelium over here. The outermost cells will be having abundant glycogen within the reproductive period. That means the younger age group children or older age group will not be having predominant glycogen over here because of less amount of estrogen acting on these cells. Try to remember this properly. The estrogen is necessary for the growth of the epithelium, is it not? Right? So the estrogen will be acting on the vaginal wall for its growth. That means the proliferation occurs because of the estrogen, which will be less in case of children before puberty and in case of elderly after menopause over here. Okay. So within the reproductive age group, this estrogen will be at peaks. That will be acting more on the squamous epithelium over here. So maximum amount of the glycogen will be produced in case of reproductive females over here. Getting it up? So this glycogen will be acted upon by these Dodeline's bacillus and will be converted into lactic acid over here. This lactic acid maintains the vaginal acidity. What for this acidity is maintained in case of vagina? Why the acidity must be maintained in vagina?
Prevent infection.
Absolutely. The vagina is clearly very close to the external environment. So the bacteria or viruses can easily enter into the vagina and infect the vagina over here. So to prevent that, acidic nature of the vagina is needed. So this lactic acid will be preventing the bacterial or any viral infections over here. Getting it on? So in case of children and in case of post-menopausal women, these infections of the vagina are very much common because of lack of lactic acid, because of the less amount of estrogen acting on the vaginal wall over here. Getting it on, right? So what is the blood supply of the So one more important terminology, which is nothing but the canal of Nuke over here. What is it? Canal of NuCH, Nuke. This is nothing but a fold of peritoneum will be carried along with the broad ligament sometimes. What is it? Sometimes. See here, the broad ligament is partly covered. That means the proximal part of the round ligament is covered by the broad ligament over here, but not the anterior part or distal part of the round ligament over here. Try to understand this. The round ligament of the uterus will be covered by the broad ligament whenever it is very much lying close to the uterus. But whenever it is passing through the deep ring and superficial ring, this will not be covered by the broad ligament over here. Getting it or not? So the content of the broad ligament is also the round ligament of the uterus over here. Okay. So this part, all the way from deep ring to the superficial and further to the labia majora, this part is not covered by the peritoneum, nothing but the broad ligament over here. Sometimes the peritoneum will be carried through this inguinal canal whenever in the form of a pouch over here. Sometimes, not all the time. So this pouch of peritoneum, whenever it is carried along with the round ligament, it is termed as canal of Nuke. What might happen if it is carried over here? The peritoneum is carried along with the round ligament of uterus into the inguinal canal. What will happen? Hernia, inguinal hernia will occur easily, is it not? It is carrying the peritoneum, so obviously the intestines will be entered over here. And one more thing, whenever you are doing posterior colpotomy, what other complication might occur over here? What other type of hernia will occur over here? Here you are piercing the posterior wall of the vagina over here, right? So you are making a nick or gap is formed over the posterior vaginal wall. And the intestines are lying over here. If this perforation is not healed over here, so the intestines can prolapse or herniate through this vaginal wall over here. Get it or not? The posterior vaginal wall will be lax over here, so the intestines can prolapse or herniate through this posterior vaginal wall over here. Getting it or not? In case of gynecologist, what mistake a gynecologist can do to the patient to perforate the posterior vaginal wall over here? You know, IUCD, sorry, intrauterine devices. Intrauterine contraceptive device. You know, copper T and everything?
Yes, sir.
So there are certain devices called intrauterine devices which should be kept in the cervix, not in the uterus. Cervix it will be kept. Okay, cervix over here. Okay. Okay. So during that time, the gynecologist will be perforating because it it is supposed to go over here and it will be kept over the cervix over here. So, but the gynecologist may perforate straight away this posterior vaginal wall, leading to the perforation of the posterior vaginal wall over here. Getting it? So, this again the posterior vaginal wall will be perforated. So again the intestines might be herniated over here. Getting it on? So because the gynecologist, if he or she might not know the proper anatomy, okay, proper anatomy, proper anatomy, proper anatomy, proper what? Anatomy. So anatomy is everywhere. Okay. Till your last year also the anatomy is there. Surgery, gynecology, orthopedics and whatever. Okay. So if you don't know the proper anatomy, you can't keep the contraceptive device over here, within the uterus over here. But you can perforate the posterior vaginal wall, leading to the hemorrhage or this herniation of the intestines over here. Getting it all right? So what is the blood supply of the uterus and cervix and vagina? Uterus and cervix will be supplied by uterine arteries over here, and vagina is supplied by vaginal artery and any other arteries. What? Ovarian arteries are ovarian arteries. So here it is very much close to the rectum over here. So obviously it will be supplied by what? Middle rectal artery over here. And of course the vaginal artery automatically will supply over here. And also other branches from the internal iliac artery over here. Okay. So all these branches will be supplied the vagina, and the uterus and the cervix will be supplied by the uterine artery. Uterine artery. And one more thing, whenever the uterine artery is going over here, it will also give rise to a branch for the vagina over here. Getting it on? The uterine artery also will supply the vagina over here. What is the venous drainage? Venous drainage will be draining into the uterus and the cervix will be draining into a uterine artery. Will be draining into internal iliac artery. So venous drainage will be entering into internal iliac vein over here. But one thing you are supposed to remember, the posterior vaginal wall and the posterior wall of the cervix or entire cervix, some veins will be draining into superior rectal vein over here. What is it? Superior rectal vein over here. So the posterior wall of the vagina over here and the cervix, few branches will be draining into superior rectal vein over here. For example, the uterus is draining into internal iliac vein, and the cervix is also draining into internal iliac vein, and of course the vagina into internal iliac vein, for example, it's okay. It is draining into the systemic veins over here, but this posterior wall of the vagina and the cervix is draining into superior rectal vein. Superior rectal vein will ultimately drains into portal vein. So here it is the portosystemic anastomosis occurring over here. Getting it or not? What is it? Sorry. Portacaval anastomosis. What is it? Portacaval anastomosis is occurring with respect to these veins over here. From the posterior vaginal wall and from the cervix towards the portal vein, that is the portacaval anastomosis over here. Getting it or not? Portacaval anastomosis. So these are two more sites. Other sites are also there. You must be knowing. Is it or not? Portacaval anastomosis. You know the other sites or not? Right? No? Over? No? Okay. So then, coming to the nerve supply. What is the nerve supply of the uterus and cervix over here? The blood vessels are present, smooth muscles are present. What nerve supply, what nerve system will be supplying the uterus and cervix? Sympathetic and parasympathetic. Sympathetic will be arising from T12 and L1, theoretical T12 and L1. So what does the sympathetic nervous system to the uterus? Contraction of the uterus is done by sympathetic nervous system. In other smooth muscles, in case of intestines and stomach, the parasympathetic nervous system will be contracting the smooth muscles. But in case of uterus, the sympathetic nervous system will be contracting the uterus. So what will be relaxing the uterus? Parasympathetic will be relaxing the uterus. Who will carry the pain sensations from the uterus? Sympathetic. Now also parasympathetic also. Parasympathetic and sympathetic also carries the pain sensations over here. Getting it on? And coming to the vagina, what is the nerve supply? Again, sympathetic and parasympathetic. And what is the other function of the sympathetic with respect to the vessels? Vasoconstriction, dilatation by means of parasympathetic. And the glands will be, uterine glands will be secreting by means of sympathetic. Parasympathetic. Glands anywhere, parasympathetic. Of course, sympathetic indirectly, whenever the musculature is contracting, that leads to secretion from the uterine glands. Okay. And vagina, the sympathetic nervous system is from What right? L1, L2 and L3, but the parasympathetic will be arising from S2, S3 and S4 for both uterus and the vagina. Okay, that you are supposed to remember. The pain sensation will be carried by both sympathetic and parasympathetic nervous system. Blood supply to the uterus, you know, histology already over. The uterine arteries will be going and forming the arcuate arteries and further spiral arteries and everything. Histology not over. Layers okay, but what are the arteries which are supplying the functional area, basalis area? Tomorrow or today?
Tomorrow.
Within 2 minutes we can finish. Within 2 minutes.
Okay.
Too much information.
Within 2 minutes.
Okay,
Too much information.
Are within 2 minutes?
okay, sir.
Within 2 minutes. Okay.
I think convince করতে করতে 2 minutes চলে যাচ্ছে। এটার মাথায় ঢুকবে না ছোট করে রেখেছি একটা করে একটা স্লাইড চেঞ্জ হয়ে এক্ষুনি চলে আসবে লোকগুলো দেখ নিতে চলে আসবে এক্ষুনি চলে আসবে লোকগুলো এখন এক্ষুনি কিসেরা নিতে চলে বল বাইরে কি পড়াশোনা করো
See, very easy. We are seeing the cross section of the uterus. All the way, this is the perimetrium. You know the perimetrium is made up of. Perimetrium is made up of histology. What is it? Fibrous tissue. What is that? Fibrous tissue. Adventition also. Uterus is partly covered with the peritoneum. So obviously partly adventition, partly cirrhosis. So don't bug up the things, imagine the things. Okay. So this is the uterine artery. The uterine artery will be given on one side. This is the left uterine artery, and this is the perimetrium, myometrium, and endometrium over here. Endometrium contains 2 layers. One is the basalis, one is the functionalis layer. Right? What's the use of basalis layer? What's the use of basalis layer? Regeneration of the entire epithelium and the blood vessels also. Functionalis? What is?
They shed in the time of menstrual cycle.
Yeah, obviously it will be shaded during the
Suitable conditions for the implantation.
favorable condition from the implantation of the glands also will be there. So is the ciliated columnar epithelium or columnar epithelium in case of uterus? What right? Ciliated bakka.
No, sir. Simple.
So both are present, but in which situations?
ওয়ার্ডটাই কি বলবো এটা ছবি তুলতে হবে
No? Don't know? It is an important question, that's why I have asked you. What is it?
Before puberty.
Exactly, before puberty there will be.
Simple.
Yeah, simple but
Simple columnar.
ciliated columnar. After puberty it will be only columnar. Okay? Okay, let us see that. So this is the uterine artery. See properly. Just 2 minutes it will get over. This is the uterine artery. It will be giving rise to 2 branches on anterior aspect and posterior aspect, which are called the arcuate arteries or coronary arteries. Coronary arteries in the heart and coronary arteries in the uterus also. Arcuate arteries in the form of an arch over here. Arcuate artery and coronary arteries. One anterior, one is posterior. And from these arteries, radial arteries will be going into the myometrium over here. So far it is outside the perimetrium over here. And now these branches will be going into the myometrium over here and forming this network of vessels over here that is called stratum vasculosus. Stratum means layer, vasculosa means you can understand vessels over here. From this stratum vasculosae, there are two sorts of branches occurs. One is a straight branch, which is nothing but the branches for the basalis layer, and the others are tortuous and spiral over here. Those are for the functionalis layer. That's all is the arterial supply of the uterus. Getting it alright? So, whenever the uterine musculature contracts, these arteries will be compressed over here, leading to the prevention of the bleeding after delivery. Could you understand? After delivery, the uterus, after delivery of the baby, the uterus undergoes constant uterine contractions. Those contractions will be squeezing these vasculature over here because these are passing through the myometrium, so that it will stop the bleeding postpartum. Postpartum means after delivery. Getting it alright? Right? That is important. Okay, great. Come over here. See that already you have seen.